right, welcome to the show, where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we welcome back to the show Saba Fatima. She is a pediatric hospitalist, and she wrote the Kevin MD article, "Being a Pediatrician Did Not Prepare Me for Parenting." Saba, welcome back to the show.
Thank you. Thanks for having me. And thanks for the podcast. I think it's great.
Well, thank you so much for being on it twice now, back for more. So we'll get into your article in a little bit, but for those who didn't listen to your first episode, can you just briefly share your story and journey to where you are today?
Yeah, so I was born and raised in Karachi, Pakistan, where I did my medical school training at Dow Medical College. And then I did my residency training in pediatrics in Philadelphia at Einstein Medical Center. And for the past 2 years, I've been working as a pediatric hospitalist at Wesley Children's Hospital in Wichita, Kansas. And I work as faculty with the KU School of Medicine in Wichita, where I work with residents and medical students. And just briefly, I've been writing articles and blogs since I was a teenager. So that's one of my passions along with medicine. And I'm really intrigued by this field of narrative medicine where you can connect both of these things together. So yeah.
So I last talked to you last year, and things are much different now. We're speaking in the beginning part of April. So just tell me, from your lens as a pediatric hospitalist, how are things going in the hospital now?
Well, I guess we were in for the biggest surprise because we did not see a single case of RSV or influenza throughout the winter. And I remember last year when we had the RSV season, we were running in and out of rooms because it's always so busy, right? It's always so busy. But I guess we know now that masking works. So our winter was pretty quiet in terms of respiratory illnesses. But now, as we've seen that the precautions are a little bit relaxed and people have stopped masking maybe a little bit, we're starting to see some late respiratory illnesses, and we're starting to see kids are getting sick. So I would be surprised to know if we get a late spring RSV season. I don't think that'd be fun. But yeah, it's been a pretty quiet winter for all of us.
So let's transition now into the Kevin MD article that you wrote. This was back in January. It's titled, "Being a Pediatrician Did Not Prepare Me for Parenting." Now, for those who didn't read the article, can you just walk my audience through it and share the story of why you decided to write it?
When I last talked to you on your podcast, Kevin, I think we talked a little bit about what it was to be pregnant in a pandemic, but I guess we really didn't talk about what happened once we brought the baby home. So I wrote this article a few months after I had the baby because I realized I was in for a huge shock that my pediatric residency and my background in pediatrics did not train me for parenting at all. Because before I thought, I know a little bit, I know the basics, so how hard can it be? I thought it's going to be a little hard, but I didn't know that I was in for a really huge learning curve. And of course, it has given me a great sense of appreciation and empathy for all the parents and families and babies that I take care of now on a daily basis. So one of the things I talked about in the blog was about safe sleep. So when I was a pediatric resident, when we used to do our newborn nursery rotation, we used to go in every room and we had like a 1.5 to 2 minute speech about safe sleep. So do this, 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 this. And then the parents were like exhausted. They would sometimes not. Sometimes they had like a blank face and they'd be like, okay, this is it. And we moved to the next room. And that would be like 20 to 30 babies in a day. And so when I had my own baby, I realized that she rejected safe sleeps like anything, like she hated it. And it was so exhausting and frustrating, I would say. Like I cried tears because I realized I was failing at this one thing that I had told all those parents. And I remember there was a day when I was trying to put her to sleep. So I didn't want to co-sleep at all because I know safe sleep works. Like it's the best thing that you can do for your baby. So I was sitting upright in the bed. And she had fallen asleep. It was the middle of the night. And I woke up 2 hours later and I was still in that upright position. And I hadn't slept. I guess I had slept in that position. And shame is the word for it. Like I felt so much shame. I felt so bad, but I was so exhausted. And I wish someone would have told me that, yeah, it's the safest choice, but it's also really challenging to do it. So I wouldn't have felt like a failure. And for me, I wish I would have told those parents, instead of just giving that 2-minute speech, and I could have connected with them more and given them more insight. But I guess I didn't know, right? So there was no way for me to tell. And the same goes for a lot of other things like breastfeeding, There's so much shame and disappointment associated with that. Because I told all the moms who came to my clinic, I was like, it's okay, you can give your baby formula. Like, it's not the worst thing in the world. And when it came to me, I just felt like it was really hard. The one other thing that I talked about was obviously postpartum depression. And when we were in our clinic, we used to give like a screening questionnaire to the moms. And if it came back positive, we'll offer a few words of support and we'll give them some resources for counseling. And, that's it. That's the end of your visit. But I guess when you're doing it, on your own, like when your own body is recovering from so much pain and you have a newborn to take care of and it's the pandemic and you can't ask anyone for help because it's COVID.
Mm-hmm.
And then postpartum depression can cause a lot of feelings where you don't feel attached to your baby and you don't feel the bonding. So I think it's really, really scary. And I wish I had that empathy for those moms instead of just, giving them a questionnaire and that being the end of the visit. So I would just say just this experience. And the funny part of it was, my husband was also a clueless parent and he would look at me and he's like, okay, you know how to do this because this is what you do day in and day out. And it was too arrogant maybe to admit that I didn't know, but inside, like I was so lost and I was like, no, trust me, I don't know this. So one of my beloved mentors from residency, I told her, I texted her, this pediatric residency, it did not train me for parenting at all. And she wrote something really nice. She said, it was really useful. She said, being a parent will now train you to become a better pediatrician. And I think that's been my journey. And I just feel like now I have a greater sense of empathy for those families and parents. And I wish I can be their friend. And, when I see them in the clinic, it's not just medical advice, go, go, go. I feel like I hope I can connect with them more and realize how tough their journey can be.
So you said that now that you are a parent yourself, that's changed how you interact with patients. Can you give, let's say, a specific example of how you incorporate your stories of being a parent yourself? Give an example of how that's changed when you advise patients going forward.
Yes, I would say before, if I was going into a patient room, I would be like, okay, are you getting enough sleep? And they would mostly, the parents would be like, yeah, we're tired. And that would be it. But now when I talk to them, it's just like, I understand how hard this is. And I really understand how hard this is. So I have, if I see a parent who's not applying safe sleep, before I might have been a little judgmental and I'll be like, okay, this is the best thing you can do for your baby. Like, why are you not doing it? But now I know that I've been through it, that it's hard. So I just want to be that positive encouragement. Like I want to give positive encouragement to them and not be like the negative Nancy and be like, why are you not doing it? I guess I'm just trying to be more understanding. But I must say, if you talk about my experiences, this empathy, I think empathy is a double-edged sword. Compassion is also a double-edged sword, I think, because just in my experience, if I've had like a bad outcome with a patient or the babies are not doing so well, it has just hit me harder now that I'm a parent. So now I realize, what their loss is and how hard it is to see your baby in pain. So I don't think that part of interaction, I don't think I've perfected yet because I still don't know how to compartmentalize and, go home and disconnect from their pain. So yeah, I think that's the hard part for me in practice for the past few months, but I just feel like I understand them better.
Now, when you were going through your pediatric training and your mentors and your teachers were teaching you about safe sleep, about breastfeeding, about postpartum depression, now, do they incorporate any stories when they were teaching you, so you had a better idea of what to expect when you yourself was a parent, or was it just purely didactic from a textbook, for instance? How much personal experience did they incorporate in their own teachings to you to better prepare you?
Yeah, I think that's a good question. I feel like it's mostly didactic. It's mostly like, you're learning the breastfeeding techniques, you're learning about like newborn crying and reflux, and you're learning about the soothing techniques. And I think the experience is mostly the one you get from families. Like when you talk to families, when you are in the clinic, they'll teach you about their experiences. But what I've realized is, when people come in there for like a 10 to 15 minute visit, they don't tell you their full story. And that's what I was doing, when I was going to my daughter's pediatrician, and she always asked me, are you sleeping? And I was like, yeah, it's okay. Like I wasn't telling her that I was exhausted because like 10 minutes, like, what are you going to fix? But, when you ask about my mentors, I feel like most of them who were parents, I feel like I saw a lot of them became parents during that time, and it just made them, I think, I just noticed a new sense of understanding in them. And at that point, I didn't realize, I think they just knew better from their own stories. And I guess that's what I'm feeling now. But if you talk about training, I think it's purely mostly didactic, just answering your question that way. Yeah.
Now, when you talk to your other pediatric colleagues who are also parents for the first time, did they share a similar experience to what you described?
Yeah, so when I posted my article on my Facebook, Kevin, like so many people, so many of my colleagues, they commented, and these are not colleagues of this time, like my people from a medical school, people from before, and they said they agreed, and they said they felt it so much, and it's just so different when you're at work being a doctor, and it's so different when you're at home and it's your own kid. So a lot of people, and I think that's why we share stories, right? Like a lot of people can connect with them, and a lot of people came and they said that, yeah, this is what they felt. And for my colleagues who have right now, they said the same thing, like you don't learn about breastfeeding, you don't learn about sleep training, like nobody teaches you that. And I wish we learned about that, the more practical aspect of it. Yeah.
We're talking to Saba Fatima. She is a pediatric hospitalist, and she wrote the Kevin MD article, "Being a Pediatrician Did Not Prepare Me for Parenting." Saba, if you were to be a parent for the first time again, what would you do differently? Or what kind of resources would you seek out?
If you ask me what I would do differently, I think I'll enjoy it more, because I'm just gonna say that I was so tired, and I just found it so challenging that I don't think I enjoyed it at all, because I was just surviving at that time, the first few months, and especially in this pandemic, when we came home, there was no one waiting for us to help us out. Like there were no balloons. It was just like, go, you have this newborn baby, your life was like this before, and now you have this, and there's nobody to help you because we're in the middle of a pandemic. So I think I would enjoy it, because now I know from perspective that it passes.
Mm-hmm.
And there is a stage when they'll, start sleeping, and they'll start getting better, and they'll start giving you joy. Like even postpartum depression, if you can treat it and you can get better. So I just think there's light at the end of the tunnel. That's what I would tell myself, and I would enjoy what I have at that moment. Those moments obviously don't come back again with that kid. So yeah, I just want to enjoy it more.
And for those first-time parents who may be listening to this podcast, what kind of advice from your own experience can you share with them?
I'm just going to say, Kevin, now I have so much respect. So because your portal is for physicians, I'm just going to talk about physicians, and I have so much respect for all those physician moms, and I'm going to say dads as well, because this is so hard. Like they go to work and they be the best version of themselves for their patients, they're totally different. And they come home and they carry all that baggage, and they're still the best version for their own kids and their families. And they totally disconnect those two worlds. So wow, this is amazing, because when I wasn't a parent, I went to work, I came home, and I'm just taking care of myself. So I had no one. So I'm just going to say to all my colleagues, I have deep respect for all of you. And I wish, my only advice is that you guys realize how amazing and phenomenal you are, and you give yourself grace, because especially in the pandemic, it's so hard to be a parent. So yeah, I'm just going to say kudos to everyone who's doing this. Yeah.
And my final question, what's your take-home message that you want to leave with the Kevin MD audience?
Vulnerability is not a sign of weakness, and it's extremely brave. Because I'm just saying this in reflection, because when I write a lot of blogs, I talk a lot about my challenges as a parent and as a physician. And somebody who has wished me well, like people who have wished me well, have came out and told me, like that might reflect you as a weak person, professionally, it can affect you or in another way. And I thought about it, and I thought maybe I should change the way I write, but no, because I realized that the reason we're sharing the stories is because someone who's going through the same thing, like people came out on my article and they talked about it,
Mm-hmm.
they can feel less alone. And that's why I said your podcast is amazing, because so many times I've went there and looked for a topic and listened to someone who I didn't know, and they have helped me through a time. So I'm just going to say, keep sharing your stories, because being vulnerable and sharing your stories is a sign of strength, and it's not a sign of weakness. So yeah.
Well, thanks again for sharing your story and coming back on the show. And thanks again for your time.
Thank you. Thanks, Kevin. Thanks for having me.